And how are things in Ireland? Is winter started?
Yes, it has started, yeah. But not too bad yet, just some frosty mornings and cold evenings.
Yes. Oh well, we have cool days, cold days. I'd say we actually had a little bit of snow last night.
Yeah.
Nothing that accumulated, but it's kind of like, okay, it's here. This is it. No more nice days.
Yes, yeah. Yeah. But it doesn't get too bad generally here. It's we get a little cold, maybe snow occasionally, but not too often.
Oh, well, you're lucky.
Yeah. Yeah.
Yeah. I sometimes call New England New Siberia. So it gets quite cold here in the winters. So and it's a dry kind of cold.
Mm. Yeah.
So
Okay.
anyway, so anything you'd like to talk about, discuss, whatever?
Um, last week, Abby, when you were chatting about the points for the different muscle groups and that,
Uh-huh.
I was just wondering, um, would you'd be still looking at spleen 3 and that for muscles that are really atrophied muscles? For somebody that's
Yeah,
all their muscles in the body really are kind of very atrophied.
yeah. So spleen 3 is sort of like for muscles in general, either crampy or atrophied, and OD is right stomach 22 is also for muscular pain, but especially when it feels like a bruise, like distending. So yeah, spleen 3 is still used. The question, the reason why I made that list up because Camille asked if I have specific points for specific muscles. Like I talk, like I say, liver force for the psoas, et cetera, et cetera. So she asked if I have like a list of points that are useful for certain muscles. So I still, you still use spleen 3 for muscular pain in general. And spleen 3 is also used for neuropathy. It's used for anything where it's about, well, it doesn't have to be just about, but it has a connection with sugar metabolism, because often what happens with muscles is that if you're having a lot of sugar, a lot may depend on the person, the muscles get contracted and ready to go, and then the so-called sugar low makes them sort of let go. So then the person can be stuck in either a cramping mode or an atrophy mode, in the long term. So that's where spleen 3 comes in for muscles in general, to, both to release muscles as well as possibly to tone muscles in case of atrophy. In case of atrophy, I would definitely add spleen 9, and I would definitely add inner yin. Okay.
Yeah. Okay. Okay. I was just wondering, Abby, if I might just show you. I have been doing some treatment for a stroke patient.
Uh-huh.
I've been doing it a while now, actually, but not as maybe frequently of late. It's a neighbour of mine here, but he had a stroke maybe a year and a half ago, and I bought I was doing the treatment with the cords, and the patchy.
Yeah.
And I purchased the patchy, but could I just show? Would you
Yes.
try show it to you?
Yeah.
It didn't look like yours. I don't know if you can see that. Can you?
Can you lift it up to your, like where your nose is? Okay, I haven't seen a little lower. Yeah. So can I see that? Can you move it to your left? All the way, a little more? Okay, so I see the back. Okay, thank you. I haven't seen these. Are these the ones that Andy Harrop sells?
Yes.
Okay. You know, they now seem to come in many forms. The original ones, like the pink ones that I have, are basically, they were Panasonic oven sparkers. That's literally what they are, and they've been modified to basically spark backwards as well as forwards. That's all they are. Because there wasn't much of a market for it, at some point Panasonic stopped making them, and or whoever it was that was modifying them or whatever. And then there came up different versions. There was one version of something that was huge. It was like, you know, it's like was over a foot long. Well, it was almost 2 feet long. It was kind of scary, and it was also very strong. And it wasn't really quite the same thing because there were two places where you can put the black clip on, one the back and one in the front, and one was milder, one was stronger. It was horrendous. It was like a cattle prod. And David Euler sells something else now that looks more like the original Pachi Pachi, which I do have. I have his, and it's a continuous spark. The Pachi Pachi, the original, is like bits, 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 tick, 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 tick. Whereas the one that David Euler sells is constant, and it's much milder. I tend not to use it, even though I have one. I tend not to use it a lot because I'm just used, you know, it's like once you're used to something. So I can say about, you know, I would like to say, well, listen, if Andy Harrop sells it and if Andy Harrop uses it, suppose it must be the same thing. I honestly don't know. I can't say, you know, because I haven't used it. But chances are it is. I will tell you that Kawai himself, what was very interesting, Kawai would put a whole bunch of 3 bypass cords all over the body and would not always spark them. But what he would do is he would connect them to an electric stim machine, some of the points. So as long as the Pachi is basically meant to, because the 3 bypass cord it has 2 diodes. So there's no way for the electricity in the cord. When you have, in an iron pumping cord, you have 1 diode only. So what happens is the flow goes towards, we say positive ion go towards the red clip, okay? Which is, it's kind of an odd way of saying it because, you know, we usually think of negative, you know, of electrons moving in electricity, but we're saying that the positive ions are moving towards the red clip in the IP cord, which is why when there is an inflammatory condition, you put the black clip on the inflammation, on the aluminum foil of the inflammation, and the red clip somewhere else to pull the inflammation out. With a 3 bypass cord, and I have some notes on it and I cannot make it out, okay? You know, Kawai did say which diode is which and what the flow is from red to green to black to blah, blah, to blah, blah. Totally beyond my capacity of understanding. But basically there are 2 diodes there. Okay, so when you have 1 diode, a diode allows electricity to move from one direction to another only. So when you touch them, it creates a gradient on its own, the IP cord, because there's 1 diode, it's the direction. With a 3 bypass cord, because there's 2 diodes, they are kind of, something needs to spark it to initiate. There needs to be some electricity to initiate it because there's no longer one gradient, there's 2 gradients, and something has to like push. That's at least my understanding. So what Kawai said was that if you have electric stim on at least one of the needles in the triangle of the 3 bypass cord, you no longer need the spark. The spark is basically to initiate the movement of the ions, okay? So I think what that tells me is that anything that will spark, whatever the Pachi is, there might be milder ones, stronger ones, you know, nicer ones, smaller ones, prettier ones, whatever. They're probably all doing the same thing. They're just jolting, they're putting some electricity into the circuitry and starting the initiation of the movement through the diodes, through the cords. And that's really all you're looking for, is my understanding of it. So I don't think it makes a huge difference. Is it the David Euler Pachi, the original Pachi, the Andy Harrop Pachi, the 2003 Pachi? I suspect they're all the same. There is definitely some difference in comfort level for the patient. So what you held seems like pretty nicely built and possibly gentler than
Yeah,
maybe what I have.
don't know
You
what
put the
I
needle in between there, yeah.
no, but what I don't like about this one is there's a kind of a little cap.
It's meant to be there. There's a reason for that.
Right.
The cap is there, so you put when you spark a needle, the needle goes between that cap. The one that I have as a cap also, it's just not as prominent, that's all. But it's very helpful because you actually put the needle between the place that sparks and that cap, and it kind of quote unquote holds the needle. Now, I don't know how well it's made, so it's possible that, that when you're sparking, then you try and pull it away, it's pulling the needle, or,
Yeah, that's what I'm finding, that it's, I'm pulling the needle with it.
Yeah, so you kind of have to figure out your technique in this. How are you going to make it, and that may be specific to Pachis. I have pulled needles with my Pachi also. That's why I knew that could be a possibility of a problem. Yeah, I don't know. I mean, the only other person I know that sells Pachis is David Euler. So, I don't think it's worth it for you to have him ship from the US to Europe. So I would say just familiarize yourself with this particular equipment and its downfalls, as well as its advantages. The main thing is how bad is it for the patient is the danger with Apaches, because, and I will say, and Kawai sparked me also. And he had some treatments that were really there's a treatment with a chain where you connect the red and the green to the chain on the neck, and then you spark the scalings to release the neck. It's actually quite effective, but you see the person go, like it literally is. I mean, it's not like with a needle, you see them jumping for a second. Here you see the muscle like pumping up, and it's not very pleasant. So Kawai could do it, and no one, including myself, said anything about it. You just didn't feel anything, and you don't understand how is it possible. He's pressing a button. I'm pressing the same button on the same machine. If I do it or anybody else does it, the patient goes, wow. When he does it, they go, oh, wow, that's nice, no problem. So my belief is he was, he had some quote unquote Qigong capacity. He was able to transmit something that we mortals don't quite have. But that's the main thing about the Pachi for me. The biggest thing is once it gives the electricity, the biggest concern for me is how bad is it for the patient? If it's mild, then whatever you have to deal with, just deal with. Spark, hold it, maybe even hold the needle before you pull it away. So there's a little bit more concentration mechanically for you. But, but anyway, so regarding this patient, the stroke person.
Yeah. Initially, he seemed to have, to respond, maybe after I forget how many, but after a number of sessions, he came back one day and he showed me how he could grasp a glass in his hand. But then that seems to have
stabilized.
Stabilized. He's even no longer doing that. And he seems to have kind of taken a retrograde step again, probably, And I'm just wondering. I mean, he has great, let's say, faith in that. He's going to actually make some more improvements, and I kind of feel that I'm not going to make any more improvement. I'm just.
Well, you don't know. I mean, the thing is, this is one of the hard things in the profession is that we actually don't know. So you are in a unique situation because usually it's the opposite. Usually the patient stops having belief in the treatment, and you are trying to you're hoping that they'll still come back because maybe you will make some progress. And here you have to, this is really a difficult situation. Like, how do we control our emotions around these things, our attachment? As long as he's willing to do it, you do it, even though it may, I understand sometimes you go, what the hell am I doing? Am I doing anything? This is useless. This is like a crap. I mean, I'm just doing mechanical bullshit. And then one day you find out that, well, actually, it seems to be working. It's not so, sometimes people are very slow and they go, it's not dependent on us. I mean, we will do the best we can, but we can't control the situation. So as long as he's willing, that's a wonderful thing. And at some point he's going to say, this has been a total waste of time. Like, I've been doing this for 5 years and nothing's moved. And, they're going to get the picture. But for me, as a practitioner, to introduce that element, I think is a bit of a mistake, because yes, I have attachments to, I want it to be more exciting. I want there to be more progress. I want whatever it is that I want. Can I let go of that and just do my fucking job? Sometimes the job is not as exciting or rewarding. Sometimes it's just like sweeping the damn streets, and that's all there is. And I'm just sweeping the street. and it's okay. Someone's got to, the streets have to be cleaned. It can be me. So, and it's like that with patients. Some patients are really, and some patients are even annoying to the nth degree, besides personalities or whatever. And so he's willing to come. That's wonderful. Keep going, keep changing a little bit. So I gather you were doing the arm, you were doing the immune point with large intestine 4 and Sanjiao 3 with a spark.
Yeah.
So maybe that's not, let go of it for now. Maybe do more scalp things, maybe continue releasing the SCM and, build up more sorry. Yeah, you were, I'm sure you were doing that.
Anyway, yeah. The last time I changed, I couldn't get a chain actually, but I first, it's not a diode chain now, it's just a regular stainless steel
That's
chain.
Okay. Those work also. They do work.
So the last time I did the foil and chain treatment. So
so you keep entertaining yourself and him and whatever until it becomes clearer where there is change or not change. But I think to be very careful about evaluating there's no change. I think when a patient is not as interested in coming, because they, often, in your case, he is interested in coming, then I have a responsibility to give them the freedom to choose to come or not. In other words, I need to say to him, look, the last 4 treatments, we have not produced anything. I feel free to go elsewhere, to look for another modality, or take a break, come back, or not come back at all. I mean, I think it's my responsibility to allow them to the freedom so they don't feel like they're, because often, how people are on the table and it's better. It's like, is it really better? They want to please you often. So as long as that is done, sometimes it's dredge work. It's not pleasant, it's not exciting, it's not interesting, but healthcare is like that, and then maybe after even 10 treatments, it's possible that something will suddenly move. I'm always amazed by the fact that people come back in spite of nothing's happening. And I tell them, think about whether, but they want to come. And then suddenly they start improving. And I'm like, wow, lucky that they didn't, now maybe they would have improved just because of time. No one knows. It's kind of not about me. Of course it's about me for me, but we're here to serve them. So if along the way I get entertained and it's exciting and it's wonderful and, fabulous. And if it isn't, okay, so today I'm sweeping the streets. And tomorrow I feel like, wow, I'm Einstein. It's like, okay, So, I mean, I have patients that I know when they come, it's going to be like, oh God, another one of those things that are not interesting, feel very mechanical, or there's all this resistance, and whatever it is, and maybe it's my resistance. So I just let go. But yeah, and just keep trying, looking for, possibly new scalp ideologies. So I would encourage you to look at some of the Yamamoto stuff. He has a whole bunch of representations of the body on the scalp. He has the traditional ones that he has, and then he has like somatotope eye on the side. He has a whole bunch of possibilities that you can keep exploring. And I don't know anything about the Jew acupuncture, but and I don't know if there's anything written on it either. So there's lots of different options to try. And Camille's on here, and maybe Camille has some ideas. I'm gonna unmute you, Camille.
Sorry, I was late. I had some business to take care of.
No problem at all. But we're talking about stroke, in case you missed the main point, that Mary Jo has had a stroke patient for a while, and he's managed, he got it, he was improved for a while, managed to grasp the cup and stuff like that, and then it plateaued, and then it seems to be going backwards. So I'm just wondering if you have any interesting tricks to offer.
Well, that's very interesting because it intersects very well with the case I was thinking of asking you about today, if there was time. To be honest, when I have a stroke issue, I don't tend to use Kiko. I tend to use Dr. Zhu's scalp acupuncture.
Okay.
So I don't know if I have much to contribute in terms of Kiko per se.
There's no, acupuncture is acupuncture. The patient doesn't care if you call it Jew or Kiko or Jeffrey, or it's like they go Jew Jeffrey. they don't care. They just care that they get better.
Yeah, right.
So let's see. What do you have anything that's worth sharing about Jew? Because I really don't know anything about the Jew style.
Oh, well, I mean, yes, I think it's quite phenomenal. I've used it for things like stroke and multiple sclerosis and all of that. Basically his style consists of a person sitting in lotus position on the top of the head, such that the top of the head is at the hairline, and basically the bottom where the person is sitting is due 20, and the arms and legs come out from there. And you literally just map to wherever the person is having a problem.
Gotcha.
And
makes sense.
And then you have the same view of the person from the back, sitting on the back of the head. So from the back of the head, you can address the spine.
Okay, so let me just let's see if I understood this. So the top of the head, the patients do 20 maps basically onto something like do 24. Do 1 or do 2 maps onto do 20. The knee.
The perineum maps to do 20.
Oh, that's the front. Okay. Well, yeah. Okay.
Right.
Fair enough. And then the arms go out to the side, say to around stomach 8, something like that.
As a matter of fact, that's exactly where you angle to a stomach 8.
Okay. And the legs, you're saying in lotus. So the feet are basically very close to do 20.
Exactly. So
and the knees, say gallbladder 18.
To do the legs, you map a line from do 20 to stomach 8, and then you go about 1 soon forward, and that's where you map out the arms. And we usually use 2 needles for each arm, and you do the opposite side.
Cool. So wait, so the legs go out to stomach 8.
Exactly.
And are we talking about, and the arms go a little forward, meaning more towards, say,
about
side of gallbladder 14?
exactly about a soon forward, but at the same angle. So obviously you can't angle exactly to stomach 8 because then that would skew the angle.
Yeah.
So you're matching the angle that you would do for the legs.
Got you. And the leg is, the knee is its stomach 8, and then the shin goes back towards 220?
No. Basically, you would do 2 needles, about a thumb apart, coming out from 220, and that would be the leg. So you're pointing to stomach 8, but you're not going all the way. You're not needling all the way to stomach 8.
Okay, so about at sun. Okay, and the arms will be about at sun in the same angle from, say, 224 or 223, something like that?
No, by the time you get to 23, 24, you're already doing the head.
Okay. So the head and neck take a lot of space. So the arm, so the arm you're still taking from 220, except you're not going towards
taking
stomach
from
8.
about a soon in front of 220.
Got you. Cool.
Yeah.
And then on the back, you saying, so now let's talk about the back, if you don't mind.
Yes.
So where is the person's head here? Are they sitting upside down here?
So the top of the head meets 220. So when you map from the back, it's as though the person is sitting on their own head.
Yes. Well, they were already, yeah. So
we can make all kinds of jokes about that.
Yes, of course. So the top of their head is a 220, and where is their perineum or their buttocks?
Would be let's see, what is the ridge? Is that 16 or 15? I think it's 16.
You mean the ridge of the hairline?
Yeah.
Do 16. Yeah. Okay.
Well, the hairline's a little lower. So no, the ridge of the head. So I think that's 16. That's not 15.
Yeah, I would say 16. In other words,
yeah.
The bottom of
so basically the spine maps roughly between 220 and 216 would be looking at the body from the back.
Okay, and then do you have arms and legs there going anywhere or not?
No, you treat the arms and legs from the top.
Okay, so for the spine, you're using the back, and for the limbs, you're using the front.
Right. Exactly.
And say for speech, which is common in
he tends to use a lot of the common scalp points for that.
Okay, the regular, yeah, okay.
Yeah.
Okay. So basically the front down, are you using anything between 220 and 224, for the actual torso or not?
Yes, you can, absolutely. And what I tend to do, and you really do map it. What I tend to do is I find that I look for a spot that's just a little bit squishy, like there's a little just sort of collection of something underneath the skin.
Yes.
And so I go by that.
Cool. Wonderful.
And then what he also will do is he will also do 3 needles going backwards towards 220 for lower jowl, and then he might do 3 needles like about a soon forward for middle jowl, and then he might do 3 soon, like another soon forward, 3 needles for upper jowl. So that's another possibility of what he does. I'll see if I can dig up a map of his. I've already
great.
Yeah, I already sent that book off to Europe, but well, I've moved my whole life to Europe already in anticipation of going.
Oh, congratulations.
So I sent 43 cartons of books went.
Wow.
But I'll see what I have that I can, and I'll share with the group. So, however, I want to share a couple of stories.
Yes.
Very briefly, where I had an experience with this. One was a lady with multiple sclerosis, and she identified to me that the problem she had with walking was that she couldn't engage the side of her trunk. Like it just felt paralyzed there, and so as a result she didn't have the strength to move her leg. So I looked in the place analogous to the trunk area, and I put a needle in where it felt squishy. And as I was stimulating the needle, because Dr. Zhu's very big on the stimulation and the chi of it, I started feeling heat coming off my hand and going up into my shoulder blade, and it started burning. And I said to myself, I'm going to keep stimulating this until it dissipates. And it took probably 20 minutes of stimulation.
Wow.
But when I finished, she walked. And it was stunning because I had people sitting in my waiting room who watched her walk in with a cane and walk out just carrying the cane perfectly fine in 20 minutes.
Very cool.
So it's quite remarkable. And I was also teaching a class of acupuncture, and this one student said, you know, part of my neck has been immobilized for some time. I just woke up one day and it was somewhat paralyzed, and I did the same thing, and he kept the needles in overnight, and the next day he came into class and he said, my throat is fine.
Mm-hmm.
So it's really quite an amazing technique.
Yeah, thank you.
And to see Dr. Zhu do it, he doesn't come from China very often anymore, but to see Dr. Zhu, the first day I watched him work, we got 4 people out of wheelchairs. We made a blind person see, and then we went to lunch. That's his typical day.
Very nice.
Yeah. So I would highly recommend studying with him, or his apprentices now. They do teach, and I could send that link along if people want it.
Yes, of course. That would be wonderful.
Yeah.
Thank you.
Yes. So that is what I do. However, I will tell you, I am a bit, and I don't want to take away from Mary Jo's question if you have any more, but it does intersect with something I was going to ask you about, which is an anoxic brain injury that I'm working with.
Okay.
Mary Jo, did you have anything else to add first? Though I don't want to.
No, Camille, work away.
Okay, thank you. So this he lost oxygen to his brain for 10 minutes. And
okay. And do you know how?
It was a sports injury.
So it was
a drowning.
A drowning. Okay.
But most people would have died, but because he was a professional athlete,
yes,
and in really top form, he survived.
Uh-huh.
So I have been using Dr. Zhu's techniques. We've managed to, I mean, he was 99% paralyzed.
Uh-huh.
He has an upper motor neuron injury. Uh-huh. And so we have gotten him to swallow. He does make some rudimentary verbalizations. I've worked on his vision and the alignment of his eyes. He now can move he can move his hands in one direction for yes and the other direction for no. He's 100% conscious. He just has no movement. And I will welcome anything that anybody has to contribute about this case.
Okay. How long has it been since the drowning?
6 months. And I've been working with him 4 months now.
Got you. Okay. So he's basically, most of his body is paralyzed?
Well,
with
it's not so much that it's paralyzed, it's that he has no control over it. So
okay.
It's just a little bit different. It's not
yes.
like a spinal cord injury.
Yes. Yeah. So the basically the feedback between the connection between the brain and the limbs or anything else is really not quite there.
Right.
Like it's not severed, but it's not operating. It's almost like okay. And one more thing I'd like to know, he can eat? Can he digest and stuff like that? Obviously
he's fed through a PEG tube, but because he's starting to be able to swallow on his own, we're talking about introducing some soft foods like yogurt and that sort of thing.
Got you. All right. Well, my assumption is going to be, I mean, it's not like I can say, and by the way, that reminds me of the last 20 cases I've seen, right?
Yeah, well, this is an unusual one, I'll tell you.
Yeah, it sure is. No, but I mean, it's kind of like, it's not as if I work in a brain injury hospital. So so here are a few options to look at. First of all, I'm going to suspect that there you might be able to find hardness or reflexes or something in the occipital area or just below.
Okay.
That would be my assumption, somewhere between C3 and the occiput. There's likely to be something. The question is also with someone like that, how do you get feedback and work with that? So
right, exactly.
So it's a cute idea. I get it. So, but you can maybe with your fingers without their feedback, but it's just a way of trying to ascertain points. But so any sort of brain injury, generally, and since it's 6 months, you would have that. So basically what you have is you want to, just above kidney 3, there may be some nodule or something that's there. Now, points that are supposed to oxygenate the brain are the bafang,
right.
The yin spring points, the second point
yep.
on the feet.
Mm-hmm.
All 4 of them, but especially the liver and the gallbladder ones. They're supposed to oxygenate the brain.
Okay.
I would, certainly Sanjiao 8, because you do need to release the neck, even though it's all, you can say this is all in the brain, but it's still, the brain has to communicate back to, So I would look at both Sanjiao 8 and stomach 41 to release the neck. I would look at certainly the kidney 3, and if not, maybe either kidney 7 or kidney 9. And either liver 8 or inner yin. I would also look at the possibility of Ren 4 and or below Ren 4. Ren 4 itself is called Guan Yuan. Guan is a gate. Well, it's more like a gate with obstacles, but whatever, but it's still a gate. And Yuan, in this case, it's written like the head on top of 2 feet. In other words, it's what's primary as opposed to a source. I mean, there's 2 Yuans. One Yuan is like the Yuan source points. That's different. That's a source, and that has the character for a spring. Whereas this Yuan has nothing to do with water or source. It just means, like lead with your head. Don't walk with your feet, walk with your head, which is probably the wrong thing to do, but, intellectually it makes sense. The head's supposed to lead. So Ren 4 is connected with the brain, which of course makes sense because the abdomen does produce a lot of the feedback, the neurological feedback to the brain, hormonally speaking. So, or the intestines do. So I would look at Ren 4 or even Ren 2 or Ren 3, as a possibility to create something. Yeah, and I would look at so even though I think that it's the occiput that's going to be where the problem is, because the primitive brain is sort of kind of between the 2 mastoid bones, breathing, stuff like that. But the interpretation of signals comes from the parietal lobe. So in the parietal lobe, if you look, it's interesting that and I would have to go point by point, and I will do that next time. I will make sure I pull it up.
Thank you.
But so you have, and because I don't know which number is which and which name is which and stuff like that, but you have points like, I think it's gallbladder 10 is called Tian Chong, the heavenly Chong, but Chong itself means to surge. So it seems like they're talking about synapses, to surge, quote unquote, is synapses. And you have, and of course I'm making all this up. I mean, if you
I love it.
Yeah, but it's like if you go to the people like consider themselves traditional scholars, they would say, Avi, this is such crap. Where the fuck did you get any of this from? But I'm just
love
saying,
ideas. It's worth trying.
And then you have another point that has the character white. I'd have to look up exactly what it is, but the white is like the myelin around the nerves. So there's a bunch of points above the ear. I mean, and again, it's like you look for the squishy, mushy, extra tissue type stuff. Who cares what the point, which point it actually is. I would look at that. And then there is one other thing that comes from names, and that's gallbladder 39 and gallbladder, I believe it's 5 or 6 here, below stomach 8. They're both called Schwann. They have, okay, so gallbladder 39 is called Schwannzhang, the suspended bell. And a bell is really like a person hitting the metal, meaning it's like a clock. It's something that's constantly working. So normally I would think about it as the heart or the lungs, especially because of metal, it's the lungs, but it can be the heart. So people with suspended heartbeats, gallbladder 39 is a very good point for them. And the other suspendeds are there's a suspended skull and a suspended hair, or gallbladder 5 and 6 or 4 and 5 or something like that. And those are good for, when the consciousness, because this Schwann is a weird character. It has the person's hanging upside down, like they've been hung, literally like a lynching or something. My imagination, at least. No, okay. No, in Han China, I think they did a lot of that. They were hanging people right and left. Well, they kind of still do in China. Sorry, I'll shut up. But underneath it, so that's already hanging, and then they double it and put the heart. So the heart or the mind is hanging, meaning the consciousness is lost, which is what happened to this person. So those are often good points for people with issues that have to do with temporary loss of consciousness, at least. Gallbladder 39 and gallbladder 5-6, if I got the numbers correctly. And I promise next time, or I'll email you with the exact metaphors and names.
You've been so kind with emails. Thank you.
No problem. I'm happy to do it. So those, that's what I would look into, finding more ways to try and oxygenate brain. There is a you can also look under the foot. Another possibility is under the foot, look at the shoe points. Okay, so if at the top you're doing the yin spring points, at the bottom, look at the shoe points, but go to the bottom of the foot. And those by Maruyama are called the Jue points. And the character Jue is like, like you're walking on a hill and you're falling, and it basically means to faint. In medical Chinese, it's, when they talk, how at the back of Essentials, they have a whole bunch of, section on stroke and heat stroke and fainting, and these are all Jue syndromes. It means something in the feet is not holding you, and the brain and or the chest goes berserk. And the last thing, this is a little less, well, it's never the last, because I can always think of more stuff to try, but he's a hard one to try things on. I would consider something around stomach 30, which again brings you back to the Rent 4 idea. But stomach 30 it's supposed to relate to circulation, not so much of the brain, but the chest, to oxygenation. And then you have your regular oxygenation points, which are, lung 8,
right,
maybe 42, and you also have lung 4, which is really more about oxygenating the ribs.
Oh, really?
The ribs. Okay. Yeah, I think we talked about it last time for some reason. Because when we talk about the teres, anyway, lung 4, but take lung 4 about 3 tsun above lung 5. It's not the Chinese lung 4.
Right.
Okay. So that's a pretty good point for oxygenating the lungs, in case that's applicable for him.
Okay, and then can you speak more about these points on the feet, because I'm not familiar with that system.
Okay. So again, I'd have to draw you a chart, which obviously I'm a little bit technically challenged on this form, but basically, take liver 3. So you pushing on liver 3, and then you can feel it on the bottom of the foot, so you know what your line is. And then basically the each meridian, and we're talking now 6 meridian, in other words, Taiyang, Shaoyang, Yangming, Taiyin, Shaoyin, and Jueyin, okay? And go to the Jingwell point of that meridian. So for example, for the Taiyin, that's the spleen, go to spleen 1, take it back to that place, so it will be just below spleen 3 sort of thing. that will be the Tai Yin, Jue point that represents the Tai Yin, supposedly. If you want the liver, the Jue Yin of pericardium and liver, take liver 1, but in this case, you're going to have to take liver 1 as at the center of the big toe, just like, say, pericardium 9 is, and take it back to your shoe line. The other ones are obvious, the stomach, the gallbladder, and the bladder. The one that's different is the kidney, the Shao Yin is different. The Shao Yin becomes exactly underneath liver 3.
Okay. Huh. Thank you.
Okay. Which brings, I don't know if that's gonna, well, the Shao Yin Jue point may be worth it because the kidney, number 1, is part of the brain. But also, no, so they're good for, those Jue points are basically good for head problems. They're good for chest problems and circulation problems. So for example, if a meridian has like varicose veins or something that are painful, the Jue points can be really good for that. Now, another kind of Jue can be the stomach chi, you can say, is also a little bit of a Jue because it's a bump as you're walking. So that can sometimes can affect the brain. But what I was thinking with the kidney is basically also on the hand is where lung 10 would be. And lung 10 is called fish, the fish border.
Mm-hmm.
Okay. Now it sounds a little absurd, but this person was a fish for 10 minutes, quote unquote.
Oh, right.
That's why I'm thinking maybe there's something, if you can, and also we're talking about his reptilian brain.
Right.
So there is a possibility that lung 10 and underneath liver 3. So so this lung 10 that I'm talking about is behind large intestine 4. So you're almost like using the yin phenomenon of what you might call the 4 gates. That might be something useful to try. And I was thinking of something else as I was going through that. So I'm basically working with metaphors. Never mind, it got lost. Sorry.
Okay.
It happens. It will come back at some point.
Thank you so much. That's lovely.
Yeah, it's just things to try.
Yes, absolutely.
It sounds like you and him are making progress, but obviously it's frustrating. You obviously you want more.
Well, we weren't getting the best care in California, but now he's been moved to a new facility, and they're actually flying me in.
Wow.
Yeah, I'm commuting back and forth.
Wow.
And in the new place, he's doing really well. He's made more progress in 3 weeks than he made in the 3 months that I'd seen him until then.
Oh, yeah. Well, good. Yeah.
So
good. Well, and you're racking up your miles, so you can become a Mediterranean person.
Well, that's this case is going to slide me into retirement, I think so. Yes.
Oh, wow.
Yeah. But anyway, I don't want to take personal chatting.
Okay.
Mary Jo, is there anyone else on the line?
No, it's just the 3 of us.
The 3 of us. Okay. I don't want to take too much time for myself, but thank you for that. That's really helpful.
Yeah, thank you. So any other questions, sharings, anything anyone would like to?
So just, Evie, if I could,
yes.
I'm not familiar with the system that Camille spoke about.
The Jew.
Yeah.
Yeah, neither am I. So hopefully if Camille made the big mistake of buying many books instead of just putting them on her iPad.
Yes, well, because we didn't have iPads,
I know.
was doing much of that purchasing.
Yeah, so unfortunately she can't just send us, but she will. But what I understood, and I can try and draw it for you, and what I understood was, for your person, which is an arm thing, go to the opposite side, go from around, say, do 21 towards just in front of stomach 8 on this line, and then go about it soon into that line, and look for something mushy and use 2 points preferably, and that might help the arm. So Ju is a very famous scalp acupuncturist. I mean, the technique is quite rough from what I understand. I mean, we're not talking about mild, just put the needle in and everything's cool. We are talking about, stimulation. But it seems like Camille said, 4 people got out of a wheelchair, 1 person started seeing, and now we go to lunch. So he is very successful. The person that I have studied more about has been Yamamoto, who's Japanese and is not related to the Chinese scalp style. That's why it's called Yamamoto New, YNSA, Yamamoto New Scalp Acupuncture, I believe it's called. So there are different systems. And Camille sort of described to us the mapping. They're all related to mapping the scalp and the body.
Yeah.
So, is that helpful?
If I can't find something online, Mary Jo, I'll draw it out and send it to Avi.
Great, thank you.
Yeah, that would be. Thank you, Camille. That would be great.
Absolutely, and also one thing that's very, very important is that not only do you stimulate the needles, but you have to stimulate the person as well. So you're massaging the arm, you're doing exercises with the arm. In fact, Dr. Zhu's clinic is really set up more as a physical therapy center. It's not like people are not laying down in the rooms like we traditionally do here. He'll put the needles in and he'll have people try to walk and try to do arm exercises. So it's very important to keep the person activated while you're doing the treatment.
So actually, I have a question. I have a patient who's had a schwannoma removed, and as a result, they hit the cranial nerve.
Ooh.
So she has Bell's palsy. Yeah, so she can't close her eyelid on the right side, and the mouth is drooping on the right side. And we've had 4 treatments by now in the last 3 weeks, and it's gotten better to some extent. When she lies down, actually, she can totally close the eye, but not when she's sitting. And even her mouth is even. In other words, when there's no gravity and there's no effort, now she's able to. But I'm wondering if you had any suggestions from this Jew style or from anything else to suggest for this person.
Well, I think he would certainly focus in the do 23 to do 24 area because that is representative of the head.
Yeah. Okay.
And then of course probably doing the 3 needles for the kidney. So basically going backward towards do 20. So right in front of do 20, he would do 3 needles.
Okay, and the kidney, because that was the
again, nerves and all of that. So he does kidney on most kinds of treatment like that. Yeah,
he's a kidney kind of guy.
yeah. But I think he would focus most of the attention on do 23 to do 24.
Yeah, that makes sense. All right, thank you. Any other thoughts by any chance?
Well, okay, for a cut nerve.
Sorry?
You said it happened because of a surgery, that the nerve was cut.
The assumption is, well, you never know if a nerve was cut, nicked, or just overstretched, because when they open things up, nerves get, and then they quote unquote, atrophy, die, whatever. And we don't know how. I mean, the surgery only happened like less than 2 months ago, so things can still change drastically. But, so I don't know what the official line is as to what happened to this nerve.
Okay.
If there is an official line to begin with.
I mean, honestly, I also would probably, I do a lot of cranial sacral work. I'd want to relieve some pressure off of that area.
Yeah.
And which okay. So it's the trigeminal nerve that was.
Yeah, I believe so.
I would have to track the route exactly, because I mean, the obvious points, the externalization of the trigeminal nerve. I don't know that I have anything to contribute internally.
Mm-hmm. Okay. Yeah.
Yeah. I mean, not anything that you probably haven't already tried.
Yeah, I mean, well, it's an interesting situation because she was referred by another acupuncturist because the other acupuncturist said, they called me and they said, I have a patient with this situation and they've researched online and said that electric stim is supposed to be what's best for Bell's palsy. And I said, well, that's not really my specialty, but I do with pachi. And, I mean, she needed to refer this person. And so this person came to me and, so I was doing the pachi and then she asked for she said her son said that the electric stim by the research is supposed to be the best. So can we do traditional electric stim? So, I'm always happy to oblige. Well, maybe not so happy, but I'm willing to try. So yeah, so I have done some of the local things and stuff, tracing, like going through the trigeminal nerve and stuff and seeing what I can do. And it's definitely done something. I mean, we're making progress, but I was think since we're talking about nerve damage and brain things and stuff. And
yeah.
And here's another opportunity to see what Ju does because I really don't know anything about. Okay, I want to see if there's anything else that that's worth doing.
I keep thinking more of osteopathic techniques of releasing the mandible. I don't know. That seems to me what I'd want to do is to see if there's any pressure based on the mandible.
Okay.
And I could talk to you about that separately if you want, but
that'd be cool. And then, yeah. And I also have some, that makes sense. And I also even have some acupuncture options for that.
Right. So. Because I would actually go inside the person's mouth and release the pterygium and move the mandible forward.
Gotcha.
And release the vomer,
mm-hmm.
the outline of the vomer, and get the vomer moving, and then pull the mandible forward. That strikes me as one of the most important.
Okay, that sounds like a bit of a specialty that I definitely don't have. So. But
I could share it with you really easily.
Oh, okay, that'd be cool. Thank you.
We could talk if you want. Yeah.
Okay, I
happy to
appreciate
do.
it.
I would love to give you something, for all of what you're doing.
Thank you. That's very sweet. All right, so let's close it for today, unless anybody has anything else that's popping up.
Super. Thank you, Avi. Always valuable.
Thank you, and I will be here next week, and we might talk then.
All right. Thank you.
Bye,
Mary Jo.
Bye. Happy fall.
Yes. Bye-bye.
Bye.